Hi, my name is Samara Younis. I'm a medical doctor and researcher at the Danish Headache Center. With this video, I'm going to provide you with a brief overview of the role of glutamate in migraine from a research perspective. So, glutamate is a major excitatory neurotransmitter of the brain, and for more than 30 years, the role of glutamate in migraine has been discussed. But the specific underlying mechanisms reflecting glutamate's role in migraine are still unresolved. Nevertheless, the contribution of glutamate to the migraine pathophysiology is still considered important. Now, why are we interested in investigating glutamate in migraine? First of all, we know that biochemical and genetic studies have implied that glutamatergic mechanisms may be involved in migraine. And medications targeting these mechanisms have been proven effective as anti-migraine treatment. But unfortunately, further development of the medications were terminated due to unacceptable side effects. Now, glutamate is also involved in the trigeminal vascular system. The trigeminal vascular system is considered to be the anatomical and physiological substrate from which the nociceptive transmission originates and yields the perception of migraine pain. So the nociceptive transmission originates from sensitized first-order trigeminal vascular neurons. Their cell bodies are located in the trigeminal ganglion, while the afferent fibers innervate the meningeal vessels. The nociceptive information is transmitted from the neurons of the trigeminal ganglion to the brainstem, which includes several nuclei. From the brainstem, the nociceptive information is transmitted further to the thalamus, which subsequently relay the information to the somatosensory cortex and other cortical areas. This eventually leads to the perception of migraine pain. And glutamate is involved in modulating the sensory transmission in the system at multiple levels, including the trigeminal ganglion, several brainstem nuclei, and the thalamus. Now, one unresolved question is to what extent glutamate is altered at the different levels of the system in migraine. And another important question is whether the glutamate levels are altered during attacks or between attacks in the interictal state, which would suggest persistently abnormal glutamate levels. Now, how can we measure glutamate levels in the brain? This investigation is technically challenging. However, in recent years, the application of proton MRI spectroscopy has allowed non-invasive measurement of glutamate in various brain structures. The outcome of a spectroscopy scan is a spectrum, where the peaks represent the concentration of different metabolites derived from a predefined brain region of interest. Now, the peaks marked with glutamate usually contain a minor contribution of glutamine as well, when using scanners with a clinical magnetic field strength of 3 Tesla. So several migraine studies have used this imaging technique to detect glutamate at different levels of the trigeminal vascular system. Studies investigating cortical structures mainly show an increased level of glutamate in the occipital lobe. And one study detected increased level in the thalamus. These studies all investigated glutamate in migraine patients outside attacks. One recent study investigated glutamate levels in the pons during attacks and detected no change. It's still unknown whether the pontine levels may be altered outside attacks. So even though we have these important studies elucidating the aspect of glutamate in migraine while providing novel information, there's still some gaps which needs to explore further in future studies. First of all, future advancements and new imaging techniques may allow a more detailed and optimized investigation of the glutamate cycle, which includes GABA and glutamine as well. Also, application of MRI scanners with high magnetic field strength, such as 7 Tesla, may improve detection of glutamate while providing the opportunity of simultaneous measurement of glutamate and GABA in subcortical structures. This is currently not reliable at 3 Tesla due to the technical challenges. In fact, one study demonstrated that simultaneous measurement of glutamate and GABA in the pons and thalamus is possible at 7 Tesla. Another aspect which would be interesting to explore in the future is measurement of glutamate at different stages of migraine attacks and other relevant brain structures. So in conclusion, investigation of glutamate in migraine is still considered important, as there's still many aspects to cover in the future in the prospect of developing new migraine treatments. Thank you for watching.